Hey guys, Davin Lim, dermatologist. So you'd like to know more about the LaseMD Ultra, which is a fractional laser used for resurfacing. In particular, this video will explain how I and my team use it in the context of treating melasma, post-inflammatory hyperpigmentation, as well as other disorders of pigmentation. So let's delve straight into the basics. So 1927 is a favored wavelength. It can be delivered by thulium or diode. The laser in question is the LaseMD Ultra made by Lutronic. It's a direct competitor to the Fraxel dual laser system itself. Now, this laser is non-ablative. In other words, the upper layer of your skin, the stratum corneum is intact. It doesn't cause ablation. It doesn't cause coagulation, not in the normal settings. This laser is really good for treating non-melasma pigment in lighter skin types. So when you're talking about lighter skin types, you're talking about Caucasian patients, and we're talking about things like your sun damage, your freckles, your lentigos, your age spots, and your sunspots, which are pigmented. That in itself is an unbelievable treatment, and most patients require between 1 to 3 sessions for outstanding results. Now, the flip side, if you have melasma, it often goes the other way around. If you're using big settings on a thulium laser or a diode laser in that wavelength, you can get worsening of your melasma. The reason being is that the target of this laser is not the pigment itself. The target of this laser, the chromophore, is actually water. This laser produces a lot of heat, especially in the rolling mechanism. And if you keep stacking or if you keep rolling it, you're putting a lot of heat into the tissue. When you put a lot of heat into the tissue, you stimulate your melanocytes, which are your pigment cells. And hence, that's why it's not infrequent that patients after LaseMD Ultra or Fraxel, when they have a treatment that's too aggressive, their melasma actually flares. It doesn't cause melasma per se, but it may unmask the condition itself. Now, here is the caveat, is that if your melasma is well controlled, in other words, if it's quiescent, and if you're on medical therapy, certainly the use of thulium lasers or diode lasers in that wavelength can help. And how does it help? First of all, if you're using very low fluences, low energy, low amount of passes, low density, and if you're very careful with what you do, it can help some patients, and it can help by actually exfoliating the pigment. So you have superficial pigment, it increases your turnover, your skin gets a wee bit darker, and as a result, the pigment turns over within a period of 3 to 7 days. That's the first thing. The second is that it can help remodel your dermis. So your dermis is below the epidermal layer, and your dermis contains certain cells, and the cells crosstalk, in other words, they communicate with your pigment-producing cells known as your melanocytes. And these cells include things like your endothelial cells, your mast cells, and importantly, your fibroblasts. And your fibroblasts are the one which this laser can also target indirectly. So when we stimulate the fibroblast does one of two things. First of all, it has an altered crosstalk to the melanocyte. In other words, the cytokine profile, or the profile of which it secretes growth factors, changes, and hence the melanocyte can actually be dampened down or quietened down with this change in actual talk of the cell to each other. The second is that it can help re-establish the integrity of the basement membrane and strengthen the whole dermis itself. In other words, it treats quiescent cells and cells which are older, right? And what it does is once you remodel these cells, the upper layer of your skin, in other words, the dermal layer is thicker, you have less photo damage, and that can help remodel your whole skin, and hence the integrity of your skin is better, and hence the pigment dropout that you may have from melasma is a lot less. Last of all, it can alter the blood vessel supply of the area. In other words, the endothelial cells. It's not like a vascular laser, and it doesn't target it as good as something like tranexamic acid. However, it can help. So guys, that's a quick summary of how we use LaseMD Ultra in our practice.